Sounds great. Well, I'm going to get started with our introductions. Good morning again to everyone. Thank you for attending. So, the Poor Policy Research Institute, otherwise known as PR, is an independent nonprofit research think tank based in Washington. PR's mission is to produce fact based analyses that inform constructive interventions, programs, and solutions. The Institute is deeply committed to impartiality, employs a human centered design approach, and emphasizes the importance of contextualized knowledge in its work. PR primarily focuses on underserved communities and vulnerable populations. PR's services concentrate on four main areas: conducting action oriented research for informed decision making, providing professional capacity building training, promoting civic engagement and data driven advocacy, and offering expert consultancy in its specialized fields. Recently, PR launched its new program, the Immigrant Immigration Initiative, I3, which offers a comprehensive range of services designed to help individuals and families not only adapt, but excel in their host environments, fostering independence, resilience, and long-term success. The goal is to ensure that all newcomers can stand confidently on their own feet and contribute meaningfully to society. And I'll also be introducing our researcher for today that's going to be presenting. Her name is Dr. Nicole Chiquan. Nicole was born and raised in Northern California. While living in California, she began exploring the research world after obtaining her undergraduate degree in neuroscience and working at the Buck Institute for Research on Aging. After some time, she moved to Indiana, where she obtained her medical degree and completed the first 3 years of her general surgery residency. Since that time, Nicole has returned to the West Coast and currently serves as one of the Seattle Children's Pediatric Surgery Research Fellows, as she pursues her dreams of becoming a pediatric surgeon. In conjunction with her surgical pursuits, Nicole is very passionate about global surgery, health equity, immigrant health, and gender equality. Due to her different interests and passions, she is also currently enrolled at the University of Washington and is pursuing her master's in public health. As a research team member at PR, she has had the incredible opportunity over the past few months to explore the challenges of immigrant health firsthand by better understanding the impact employment barriers have had on Afghan immigrant health here in Washington. And now I'm going to turn it over to Dr. Nicole to begin her presentation.
Perfect. Thank you, Samara. Give me one sec. Awesome. All right. If I can just get a thumbs up that everybody can see my slides, I'll go ahead and get going. Awesome. Perfect. Um, so as previously mentioned, my name is Nicole. I'm one of the senior researchers at PR, and today I'm going to be walking you through the findings of our most recent research endeavor, which was basically examining the barriers to employment among Afghan immigrants in Washington and the impact employment barriers had on their health. To begin, I'd like to start with a land acknowledgement. If we can all just take a moment and acknowledge that the Indigenous people that have and still continue to inhabit the land that this research was conducted on and the land that we continue to occupy. We thank the Coast Salish people on this land, the land which touches the shared waters of all the tribes and bands within the Duwamish, Puyallup, Squamish, Tulalip, and Muckshute nations for their protection and stewardship of this land as we acknowledge the injustices that were and continue to occur to the Indigenous peoples. Additionally, I would really like to extend a heartfelt thank you to our community partners, some of which who are able to join us on this call today, including the Kabul Washington Association, the Afghan American Cultural Association, the Hazara Community of Washington for their individual and invaluable contributions to not only our survey development, but also to its distribution and continuing to assist us throughout this project and others. I'm also deeply grateful to our team members who were instrumental in helping to translate our survey from English into Pashto and then also in Dari and Farsi. And then finally, I'd also like to thank Satara, who is also a team member and really helped to recruit female survey participants and helping them complete the survey as well. Lastly, I would really like to thank Shir Meharar for his unwavering support throughout this project, his dedication to community engagement, and basically the vital role in helping to translate the qualitative data. All of your collective contributions have made this project possible, and so we are all very deeply grateful for your continued support. So briefly, for today's talk, I will be walking you through why we did this project, through a little bit of background and a review of literature. And then I will be describing the methods we used for this project, and then I'll go into the results and analysis, and then finally I'll leave you with some recommendations. So briefly, what was this study and why did we do it in the first place? As I mentioned, we sought to identify the barriers to employment experienced by the Afghan immigrant community here in Washington and the impact these barriers had on their health. And then we sought to offer strategic interventions based on our findings. Why this study is important is that we know the Afghan immigrant population in Washington is growing. In fact, an estimated 2.5 million individuals globally are registered as Afghan refugees, and they compose the second largest refugee population in the world. In 2022, after the withdrawal of US troops and the emergence of Taliban rule, as many as 2.7 million Afghan refugees have fled Afghanistan, with an estimated 86,000 moving to the US. Washington has remained a top destination for these individuals, as the state has welcomed nearly 8% of the country's total special immigration visa holders over the past 3 years, and it remains one of the top 5 states welcoming refugees overall. In conjunction with this, there's growing evidence that suggests this population suffers from high rates of unemployment and/or underemployment, which leads to high rates of poverty, increased risk of exploitation, and increased rates of emotional distress. In fact, when we control for cost of living, Afghan refugees' median family income is near the bottom when compared with other minority populations in the US. And this includes other immigrant populations like Mexican immigrants and minority populations like US-born African Americans. So gaining employment is seen as crucial for this population as it provides a means to escape the poverty described above. It also helps these individuals reclaim their future, helps them to rebuild their lives, and reduces the risk of exploitation. Additionally, it's important to note that high-quality jobs often provide better health insurance or access to healthcare services. So not being able to secure this type of job may also be a barrier to obtaining proper healthcare and treatment to the dental, vision, emotional distress, and infectious diseases that have been identified as high needs within this population. So we felt it was critical to better understand this population, the barriers this population faces to gaining employment. And to do this, we asked 3 main questions. What are the barriers to employment that Afghan immigrants in Washington face? What are the impacts of these barriers, particularly on their health? And what program or policy changes can we implement to actually help? So moving into the review of literature and the basis for the study, as I mentioned, the Afghan immigrant population is growing in recent years, especially after the rise of Taliban rule, and many Afghans have fled to the US, specifically Washington. Studies, including some of our own out of PR, have shown that unemployment is a struggle for this population, putting them at increased risk for exploitation and leading to higher rates of poverty. Now, moving into the survey design itself, for this project, we used a mixed methods approach, meaning we used both quantitative research methods and qualitative research methods. So for our quantitative methods, we created a 41-question Google survey, which was developed with the assistance of our community partners and then administered to voluntary participants in the community over a 4-week period. There were 4 domains in the survey, which included demographic information, and questions about employment status, questions about any barriers to employment, and then any health outcomes information. The survey was available in English, and then through the assistance of our kind volunteers was translated into Farsi and Dari, as well as Pashto. And then those who needed assistance with its completion due to comprehension or language literacy challenges, a community partner was able to assist them in the completion of the survey. The survey was used to primarily gather quantitative data. However, there were several open-ended questions, which enabled us to gain better insight into the participants' experiences and provide qualitative information. Following the completion of the survey, a focus group was conducted with community leaders and key informants who helped to elaborate on their own experiences with the community, the barriers they saw, and the impact that this has had on their health. Once the focus group was completed, it was transcribed into text and then analyzed for key themes. For our analysis of the survey data, all of our continuous variables that had a standard distribution were assessed using a mean and reported plus or minus the standard error of the mean, while those that did not follow a standard distribution were reported as a median with interquartile range. Our analysis was completed in Microsoft Excel, and then groups were compared using Pearson chi-square analysis with a significance set at 0.05. This slide basically summarizes our demographic characteristics of this cohort. We had a total of 76 respondents. 52% were male, 45% were female, and 3% chose not to disclose. The mean age of our respondents was 34.5 years old, and the mean time our population had resided in Washington was around 34 months. The primary preferred language of communication was English, followed closely by Dari and Farsi. The majority of our respondents had at least a bachelor's degree prior to their arrival in the US. Additionally, 55% of our respondents noted their access to healthcare was primarily through Medicaid and not through other means like employment. Moving into our assessment of employment, we found that those who noted they were currently employed were primarily full-time employees, meaning that they worked between 35 and 40 hours a week. Additionally, we noted that employment types between participants between the US and Afghanistan for our cohort did not vary significantly. So there was no large differences between types of employment between here and then prior to their arrival to Washington. Participants were then able to identify significant barriers to the employment, which included language barriers primarily, and those who identified this as a barrier had noted that they participated or utilized a language education program. Additional barriers included the availability of childcare, household duties, and this was primarily for female respondents, and then transportation was also noted to be a large barrier for this group. With closer assessment of language, we saw that not all participants were actually able to utilize the language classes that were offered, and this was due to limited availability, transportation issues to getting to class, the actual cost of classes, and then their learning preferences. This graph also compares English proficiency prior to arrival to the US and then on arrival. And while we do see some mild improvements, these were not statistically significant. When assessing the physical and mental health of our cohort using a Likert scale before arrival and after their time in Washington, there was noted to be no statistical significant differences in our cohort of respondents, and this was regardless of gender. For our qualitative analysis, we noted that childcare was again a key barrier, especially for the female community members, as was obtaining a driver's license, which was felt to be especially limiting. Also interesting to note, the female community was felt to be most impacted in terms of their health due to unemployment, with reported declines in mental health as a result of this. Also, language was again noted to be a barrier, with further elaboration explaining the challenges of getting appropriate language classes due to limited availability of courses. Additionally, the theme of underemployment was raised as an issue in our focus group, as many community leaders felt that their community was able to obtain work. However, it was beneath the skill set that they had, but this was not reflected in our quantitative data. So through our analysis and in discussion with community members, key changes to improve the barriers identified include adjusting the resettlement programming to be more cohesive and to not only include things like language classes, but to also tailor it to be more specific to Afghan culture and to include other key parts that will help in employment. So incorporating aspects of transportation assistance, how to get a driver's license, which driver's ed classes to utilize, and then soft skills, particularly for obtaining a job, like interviewing skills, how to present and write a CV, and more. Additionally, it's important to note that some of our study had some limitations, particularly that it was a small sample size. So it may not reflect the larger group of Afghan immigrants here in Washington. Additionally, because it was a survey, there is some selection bias, and these are self-reported data, so it may reflect a participant's feelings, but not their actual behaviors. Additionally, there may have been some language barriers, although our survey was translated. There may have been issues in language comprehension as well as in the way that it was structured. Finally, I want to note that the survey, as I had mentioned earlier, our cohort was pretty recent to Washington, meaning that they had kind of immigrated more recently in the past couple of years. And so it may not actually reflect the broader needs of the community, especially for those members who have been here for a longer period of time. I thank you very much for tuning in. Clearly, there's some more work we need to do, but these findings help to illuminate some of the challenges the Afghan immigrant community of Washington faces, and then basically key insight into how we can improve in the future.
Thank you so much for that, Dr. Nicole. And if anyone does have questions, feel free to put it in the chat, or you can wait until later on. We're actually going to move on to getting some stories and perspectives from community members, and then we'll move on to questions after that. So we're going to begin with engineer Farajid. And he is going to be telling us a little bit about his background, his experiences of applying for jobs, so the job search, thoughts on the job market as well, and then also what roles agencies that are supposed to help immigrants have played in that process, if they've been helpful or not.
Thank you very much. Do you hear me?
Yes, I can hear you.
Oh, thank you very much. Firstly, I think it's the first in kind that this research has been conducted here. Thank you from the research team and also especially from Dr. Nicole. I think documenting this issues and this research is very vital for the future of the resettlement or better resettlement of Afghans and generally in the US, but specifically in the Washington. As for me, my name is Nurullah Farajid. I was basically I started my work with a tech background and then shifted a bit working towards somehow using this tech to benefit the people. I was working almost for over a decade with the United Nations. And my recent role was that there I was leading a unit called, sorry, Knowledge Management Unit, which was responsible for somehow utilizing technology for the betterment of the societies. We can say it in a broader picture, but in a specific, we were documenting the knowledge and processes that was helpful to develop the communities. And then, of course, data was main part at our unit. And then doing some basic research and also monitoring and evaluation of the projects that we had. With this background, now after I can say post-Taliban, I also escaped from Afghanistan. I can say unfortunate in some prospect, but in some of others, I can say I was fortunate. So coming to here, being new, even in our own country, has its own challenges. When we, for example, move from one province to other province, for example, within the United States, from one state to another state, it's challenging. But coming from another country with a wide changes, I can say, or differences, including cultural differences, environmental differences, even the weather has its main impact as well. It's challenging, to be honest. I can list some, but not all. When I came first in the US, First, I was struggling to find a community. However, I can say that in Washington, the Afghan communities are active um, more than any other states in the United States, I can say. Or if it's not the most, it would be the second. But still having that, I find struggling to connect with them in network even within my communities. I mean, in comparison to the local communities here, I'm still struggling. The second one was lack of resources. I think one of the pros and cons, I can say the cons part of the migration agencies or settlement agencies that work in here, they're a bit short in terms of advocacy, in terms of information sharing, because there are lots of opportunities with them, but the 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 beneficiaries are cannot utilize them. So this is a big gap. I don't know, it is information, it is resources or advocacy or reaching. It was my experience. I cannot generalize it to all, but it may be beneficial. And the second was the recognition. Recognition in terms of not only the educational, from educational perspective, but also from working experience. For example, I was working in a multicultural environment in Afghanistan, which we had from basically within the United Nations, we had from every country, I can say, even from the US and all over the world. But here, the only thing that I went up to the interview, the first interview, the second interview, but I found out that some of them mentioned to me that you have no experience in the US, so it's a point of weaknesses for you. So that was another challenge. The the third and fourth one, I can specify the financial barriers because when you come new, I know the US economy is very strong. When you come in from a lower economy comparing to the US, it's very challenging and struggling for the new arrivals to somehow resettle in here. And the last one, but not the least, I can say the networking is I think it's the big challenge. I found that during being here for at least the first 6 months, it was very challenging. And then even I know that some of the people, as per your research, shown that the language barrier was the top one. But after the language barrier, this networking, maybe for those who have no language barriers, the networking is really challenging here, to be honest. And then some recommendations, I don't know, I have not gone through very deeply, but it was digging deep, I mean, from your side, maybe with regards to some strategies that how can integrate Afghans or new arrivals within the communities through the migration agencies, or even if not, we can do it. For example, my personal experience or preference was that instead of bureaucratic and paperwork and these things which is going on within the government and also within the agencies, instead of that, finding a way to fastly connect the new arrivals to the work source, either by volunteering, internship, or any other means. I mean, for the internship, there are some specific rules that many of the companies cannot take. If we, as a policy recommendation, if we can advocate for this, that many other organizations should be flexible around this, and they can include the new arrivals within this criteria or within their criteria. That would be, I think, very helpful, specifically when I'm assessing myself. If I have the opportunity to go somewhere, even working as a volunteer, and then knowing the community, establishing the relationship, and then I can find which job, which company, where can fit for me better. Thank you very much. I think I spoke a lot. Thank you for your time. And if any question, I will be there. Thank you very much.
Thank you so much for sharing that, Farajid. We really, really appreciate it. We're going to be moving on to Engineer Harris next. I'm not sure if he's here.
He's there. Atif, do you hear us, please? Yes.
Sorry, I am here. Yes, just I
Okay.
lost the mic icon to unmute it. Sorry.
Would you like me to go over the 3 topics really quickly, or are you good to go?
It's okay. Thank you very much.
Okay, great.
First of all, let me thank you and appreciate all of you respected attendees to the meeting. And thank you very much for giving me this opportunity to talk and to explain the barriers and the problems I faced during my stay in the United States. To be honest, and to say the truth, if you, for example, go to your friend's house for invitation, I'm sure that you will ask for him where to sit. And for example, if you need to use the bathroom, you have to ask him where's the bathroom, or you will see where's the kitchen and where to sit and where to talk. You know why? Because you are in a new environment. You don't know that 50 square meter location, small house. So if you compare it to a continent like the US, it's a continent, consists of 50 huge and wide states, more than 350 million of people from all over the globe. So this country, it's a strong economy and strong knowledge. All of them is combined together and creates an expectation to all the immigrants who are coming here. Actually, to be honest, you know that the main point and the main thing in every person's life is the economy. One important point that every immigrant comes to the US and face, the first thing that they give you, that they, for example, offer you, is that we will support you 3 months. After 3 months, you have to pay your own rent house, you have to find a job for yourself, and you're on yourself. Of course, that would be great. We appreciate that they boost us, they make us to move on, they make us motivated, but not in the right way. You are new in a location, you are new in an environment, you don't know, for example, the avenues, the histories, the locations, you don't know the companies, you don't know where to go. All these problems and barriers, they give hand together and create a huge psychological problem for the person and lots of other problems which affects not only for the person, for the family members who are around him or her. But Actually, if I were from instead of the US or agencies, first of all, they have to provide or they have to create a condition that evaluate the level of the knowledge of the person, that in which level of knowledge or language he is. Can he speak fluently? Can he just solve his daily issues? If yes, let's introduce him to some locations to start his initial jobs, at least to create a background for himself. Not to just tell him that, hey, be careful, our support time is finished. You have to pay, you have to just pay your rent house. You have to be on yourself. This automatically makes the person panicked. You will be panicked. As soon as you're panicked, you can't take the right decision. You just do anything. You can't do anything actually. So this is a barrier, a very big problem in front of the or against the newcomers in the United States. If you see, then they send you, for example, from DSHS maybe, they send you letters that you can go and study English language to improve yourself. Okay, thank you very much. We appreciate it. And from the other side, they're asking that you have to find a job. So now the person has to work full-time or part-time somehow. Then he doesn't know the language. So how he can work whereas he doesn't know the language? While you introduce him to go to study and learn language, so how can he work? He should study or he should work. He should select one of these, at least for a year, not for all over his life or her life, not for a decade, for example, at least for a year. For 1 year, the United States should support all the immigrants, pay for their house and pay for their expenses, all of them, all of them. So after 1 year, the person will automatically understand the language, will understand the behavior and the way of working in the United States. For example, I learned a lot in these 4 months. It's my 4 months in the United States. Actually, to be honest, we can say that we must have a background in the US because the way of working, the way of talking, behaviors, everything is different here. The cultural shock that the people are saying is not only that you see the cultures, even the walking, as my friend before, they mentioned before, the weather, the sun, everything is different in here, the transportation system, everything. So this all creates a barrier in front of the person, against the person, anyone who is in the United States newly coming. So for this, they should support this person in a way that he normally and slowly just go straight ahead to the street, we can say, to the avenue. He understands his path, to select his path. I gave many interviews in different locations. We face different type of CVs, for example, to arrange. We face different types of interview questions. No one told us that here is some different type of CVs, for example, here is different type of interviews. You will face different questions, actually. So all of them, there are very big problems against the immigrants. This causes some health problems for them. They think a lot, they become panicked, they can have different behavior with their family members. Eventually, they do not enjoy being in the United States. They become very, how can I explain? Because they hate America. They will talk with themselves that why you came here in a place that we don't know where to go, what to do, how to find a job. So support is needed for any immigrants, at least for 1 year. They should support them for 1 year. And upon the arrival, they can say that you will be here under support of our government for 1 year. You will be paid for everything. But what you have to do in this year, in this 1 year, you have to learn the language. It's very important. We talk to them. Yes, we get promise from them. You will learn the language. After 6 months, we will introduce you voluntarily to some organizations, for example, that you know the rules and regulations of the offices, how to work with them, how to behave with them, how to use the accessories, for example, according to the interest and according to the background of the person that she has. For example, she's an engineer, a doctor, a computer science network engineer, or any other field of study that she has. So this 1 year duration will be a very good time for the people to learn English to find an experience, and to be a good asset for the future of the United States. At the end, what I want to say, all the agencies, they should change their structures. It is not the right way. I haven't seen my agency for a long time. I saw that person 3 times, and that's it. All was I was doing myself. I got my license for myself. I got ID for my family member and everything. So lots of problems I face in this duration. And the last thing that I want to say is a proper plan should be prepared by the agencies, by the government of the US for the newcomers. It's difficult in a very big continent to provide facilities, life facilities, work facilities for ourselves. It's very difficult. So 1 year at least, support them, make them be happy in this 1 year. Make them enjoy the United States. It's very difficult for us that in the new country we are coming all people, but one important thing that people who are in Afghanistan, oh, they're in the United States. But when we are in the United States, we are just regretting that why we are here. We don't have any work, we don't have any place to go, we can't enjoy it. Humans, they like or they want to enjoy beside your work. You work, you earn to enjoy. So nothing of this is achieved by the newcomers. I hope that this plan that I told you just be concentrated by the agencies or by researchers, that in future, at least let's pave the ground for the immigrants to study the language, support them a year, provide that 6-month work experience duration for them, then automatically they will boost their knowledge and they will start working. Thank you very much.
Thank you so much for that, Harris. Isan, do you have any questions for me, or would you like to open up the floor and see if any other community members would like to speak?
Yeah, let's open up the floor, and if we have some questions, we will ask our friends to raise their hands and just ask their questions. Or put it in.
Yeah, of course. So if anybody from the community would like to share their experience, their story, or if you have a question, please feel free. And I actually have a question for Dr. Nicole while people think about it. I was wondering if I don't know if you know, but the medical care that they are receiving, is it comprehensive at the moment, or would you say that there's parts of it that are lacking?
So we didn't delve in our questionnaire into what kind of care they were receiving specifically, if it was primary care or ED visits or whatnot. I think that would be a next step. I think probably the best place to start would be kind of comprehensive care. And so as we kind of talked about, or some of our participants talked about their own experience being supported, I think it would be important to study and see what would happen, after a certain amount of time the Medicaid benefits are stripped away. And so seeing during that time period, does their health suffer? Are they not able to get the health care that they need in terms of primary care needs or other chronic care needs? So I don't know.
So that happens, their Medicaid.
It can't, they have a little bit of wraparound coverage for a certain time period. And forgive me, I can't remember off the top of my head. And then they would have to apply basically into the general pool for Medicaid. So anybody else in the US would apply for it. So they're supported for a certain period of time as a new immigrant. And then after that period of time, they then need to basically transfer over just like anyone would be applying for Medicaid. And having done that process myself, it's actually very difficult. For me personally, when I was in my training, I wasn't employed because I was a student full time. And so I think it took me almost 4 months to get approved. And I would say I'm fairly health literate. I work in the system. And so I can imagine it'd be very challenging working full time, trying to work full time, not being fluent in English, trying to navigate that would be extremely overwhelming.
Thank you for sharing that. I appreciate it. Tamara, you have your hand raised.
Hello, my name is Tamara, and I am from Nashi Immigrants Health Board. and I appreciate all of the presentation and the community speakers. My question is related to these same issues we're talking about, and I'm curious around data that is questions the status, since if someone's coming through a refugee program versus just immigrating based on their own need to switch countries, the path to kind of acculturating and being able to navigate into the new country is different, and it also affects that health insurance piece. Because if your path is through a refugee program, it's still temporary until another program opens up or you change your status. So I was just curious from the actual community members as well, if that was something that you were facing based on your status being a specific status that is a different status than other citizens in the US.
I'm not sure if any of our speakers would like to disclose that information, what their status is. If you do, you're more than welcome to. If not, that's okay.
Yeah, I would like to do that. Hey, team, my name is Zaouf Bashardost. I'm the former president for the HCWA. We're a CBO, community-based organization, nonprofit. Speaking of the Medicare card and also the health side of the house, I've dealt with numerous amount of these application to the Washington State Community Health Plan. There is the category of people who are coming based on the documentation that they have. It depends on the documentation. So if they are SIVs, for sure they got the benefits, and if they are refugees, recognized refugees, came from, let's say Turkey, or been in the United Nations program for a couple of years, and then they got approval to that one. That is have the same benefits as special immigrant visas, but there are those people who come under the there is a new program that people who coming from the border recently and immigrate into this country or to our country. Or say it depends if they have a work permit or their Farm I-90, they call for that. They provide only 6 months of health benefits. After 6 months, they basically discontinue their benefits, and it's very.
Ralph, are you still there? We can't hear you. Okay. Well, if he reconnects, we will let him continue. Excuse me. Shalom, I see your hand is raised. You can go next. I just want to announce really quickly that the report link has been put in the chat. So if you'd like to take a look at it, please go ahead.
Right. Thank you so much. And thank you everyone who has spoken. It's been really insightful. My name is Shalom. I'm a PhD student at the University of Washington, studying health policy. I wanted to ask this question. It could be to the researchers or the community members in here. So I'll be actually working on a similar a research study on impact of language barriers, actually, on the Congolese immigrants in Washington State. So I just wanted to dive into a question on that. Based on your research, do you think, how can language proficiency or lack thereof, how did that really impact the Afghan immigrants' ability to secure their jobs or find something that aligns with their skills and qualifications? Because I know you did mention that there was that gap between the employment of what they did, in their country of origin versus what they could secure once they came here. So I just wanted to kind of learn more a little bit about that, what we kind of saw, and if there's any language assistance programs that you saw that really helped out, if these can be expanded or adjustments be made.
I can speak to like some of the research. I think we got a little bit more insight from like the qualitative aspect, and I would encourage everyone to, if they're interested, just reading the report because I can't quote them off the top of my head, but some of the actual experiences were pretty impactful. A lot of folks really felt like there was issues not only communicating with their team members, so like even if they secured a job, not being fluent in the language actually was a barrier because they couldn't communicate well with team members. And then they had several people who went for interviews, and some of them reported that even though they made it certain way through the interviews, if someone was, naturally fluent in English or had been in the States for a longer period of time, it was given to them because the management felt like it would be too much of a burden or too difficult to try and incorporate them into their programming. And so that's kind of where I think a large issue is with employment, is that management currently views it as a barrier. So it's a limitation for participants to basically join their employment force if it's going to be something that the management has to work around. They want things to be easy, right? That's kind of their MO. And then in terms of the classes, from my understanding, there are free classes available, or maybe they're not free, they're compensated, but they're difficult to get to. They're only offered at certain times, and the wait list can be up to like 6 months long. So if we are saying that you're only supportive for 3 months, you have to work during that time, and you also can't even get into the language classes for 6 months. It's kind of contradictory to how we're saying we're supporting individuals. And then I know there are some programs that are trying to make their own language classes because they can't get into the, provided ones. But even those that had been created, participants felt like it didn't adequately prepare them enough to be able to use English on the job. So whether that was using specific jargon or interviewing, they didn't feel like that was sufficient. So I think the next step would be either expanding what programs we're offering so that the waitlist isn't so long, or creating new programs that are more tailored to, business jargon or CV preparation, those sorts of things.
Thank you so much. Farajid?
Yes, thank you very much. First, I wanted to continue as Raouf Bashardos is off, I think. We couldn't hear again. But on the last question about the status, yes, it has, pretty effect on the benefits, especially from the government, from federal and state benefits. It has the type of visas or the type of new arrivals that they are experiencing through visas or any other programs are quite different, and the information is a lot. It's beyond of the capacity of single one to go through all of them, to be honest. And then a summarized version of the information is very difficult to find. There are the visas basically is first from the SIV, which is special immigrant visas. They have their certain benefits. They're a bit comfortable. Because the duration of the support from the government is a bit longer. And then the refugees also have almost the same benefits. But when it comes to the protection visa, it's quite different and quite wide range of the beneficiaries that is allocated or dedicated to them. It is P1, P2, P3, and then another general protection visa, general protection, I cannot say they lost type as a visa, which is only called as a parolee, which is coming through the borders. But the recognition within this, according to the knowledge and to the employment environment, is quite different because some people, even they are coming through SIV, they are struggling to find jobs, and some of them are a bit comfortable. And then from refugees, the same. However, refugees has a little lower background than the SIVs, and another type of people who are coming through P1, P2, P3, they are better with their knowledge and skills. And then from the as a parolee from the border that they are coming, their skill set is very different. I mean, they even are from low level to very high level. But one recommendation was from, I think, from our friend, was that assessment based on the knowledge and skill sets are critically important. That who can do what, and according to that, they can plan their future path. That's very important. And then for the language barrier, I do agree. Yes, there is a big impact. But one thing that was, it is my own experience rather than, I cannot generalize it. However, I can feel that a huge percent of the new arrivals are facing the underemployment because they have the huge responsibilities that they cannot deal with all of them. Securing housing, finding relationships, and then the type of life here in the US is quite different than Afghanistan. For example, in Afghanistan, one people in a family of 5 to 8 is responsible for all of the things. They are coming from that background, and then here, one single person should manage all of them, and then adding the seeking employment and going for the appointment, and also having some skills empowerment, and these things are critically important. And then it's really challenging, to be honest. For that, I mean, I can say from top of my head, however, it may not be very backed by research and data. However, I can recommend the coherency of the supporting agency and the funding from the government, that somehow making them accountable for both side or both party would be effective. And then, as I mentioned, from the lack of information prospect, I think many of agency can do that, and this is in their ability and capability areas, that they can, for example, release a short documentary and defining the steps and posting them to the social media and translate them not only in Dari Pashto, even for all other languages as well, because I saw many agencies have the language proficiency a lot. Thank you very much. I'm generally speaking a lot. Sorry.
That's okay. Thank you so much, Marajid. Nancy Rose?
Hi, thank you. I know a few people on here, so good to see you. I am from New Americans Alliance for Policy and Research. We're based in Kent, and we published a report that just has so many very similar findings to this. So I appreciate the work you've done, and I just wanted to say there's a lot of congruence between our reports. We did focus groups with 130 refugees in King County, and about 40 to 50 of them were from Afghanistan. And we heard these same concerns that you heard over and over again. And I just wanted to echo that a few of the folks who have spoken today talked about the need for English first and foremost. And in order for that need to be met, the need for assistance, financial assistance from the government for a longer period of time. Because for most people, as has been said, it only lasts for 3 months. So one of the problems is that the way refugee policy has commenced, gone in the US over the last 40 years, the this financial assistance has been seen as potential for welfare dependency. And we really think it needs to be seen as a kind of transitional assistance. Giving somebody assistance for a year, as has been suggested in this meeting, does not mean that someone is going to stay on that assistance. It actually allows people to become self-sufficient faster because they're able to concentrate on learning English and concentrate on building skills and then get a better job, a higher wage job in the future. And what we heard over and over is that lots of people who are coming from Afghanistan with a lot of educational experience were struggling to get jobs in those same places, in those same types of workplaces in the US because of lack of English and then lack of credentials in that area, lack of US experience. And so I think 80% of people from Afghanistan who we interviewed said that they had decrease in their kind of in their work place, downward mobility. Sorry, that's what I was looking for, in terms of their employment. And we just heard, we heard that over and over, and a lot of it was based on learning English. And again, the same problems that people have said today. Huge wait lists. We have people who are on year-long wait lists to get into their community college English classes. And then also a lack of support in finding jobs, which I've heard again today, that people, if they did receive any support at all, maybe it was writing a resume, but caseworkers were helping people to find survival jobs mostly, and rather than helping people with what they wanted, which was like training of I have this goal, how do I move into that in the future? And actual kind of career coaching was what a lot of people were looking for. So I don't know. I don't really have much to say other than I agree with everything that has been said here. And I just think that we need to work together to make these changes, because I think everybody who's been through the experience themselves or talked to people who have understands what needs to be changed and what the problems are. So thank you.
Thank you so much for sharing that. I think it definitely helps to see that these issues are here. You see them in your research. Dr. Nicole saw them in hers. We need to solve them. We've come to the end here. I want to thank everybody on the behalf of PR for joining us and listening to this, listening to our community members. And I just want to let you know that the research report is in the chat here if you want to take a look at it. It'll also be on all of the social media channels that PR is on, Facebook, X, LinkedIn, and then also stay tuned for future initiatives through PR, such as the I3 that I mentioned. That's for empowering immigrants through integration programs. Sorry about that. Thank you, guys. Yeah, thank you so much. I hope you have a great day, and thank you.